Yes, so we move on to our next panel discussion now. The speakers are here. I'm going to invite them on stage. Our next session is going to focus on optimizing body shaping. We're going to be discussing patient cases that define challenges and successes. I would like to invite our session moderator on stage, Dr. Anuya Manerkar, consultant dermatologist and director, Panache. Dr. Anuya is a skilled consultant dermatologist and cosmetologist at Panache in Mumbai. She specializes in hair growth treatment, botulinum toxin, thread, skincare, anti-aging treatments, and glow treatments. Joining her would be Dr. Purnima Matre, medical director, Angel Health. Practicing for more than 30 years, the founder of Angel Premium Health of Aesthetic Clinics, she does not believe in quick fixes but caters to holistic health and well-being with specialized treatments for skin, hair, weight, and healthcare. Also, let's welcome Dr. Medha Bhave, plastic surgeon, director, Param Hospital and ICU, Laser Cosmesis. Dr. Medha is a distinguished cosmetic surgeon in Mumbai, known for her expertise in aesthetic and reconstructive surgeries. She established the Department of Aesthetic Surgery and ICU at Param Hospital, performing major procedures like liposuction, rhinoplasties, and facelifts. She continuously incorporates advanced technologies such as body tight, ultrasound, liposaver, and pico laser. She is the Vice President of the Indian Association of Aesthetic Plastic Surgeons. Also requesting Dr. Umang Kothari, Founder Director, the Hair and Shape Clinic, to join us. With over 10 years of extensive experience in aesthetic and reconstructive surgery, Dr. Umang is a premier national mentor and global trainer for Reveal Lasers, specializing in microlift and microtight procedures. He is also a member of the National and International Aesthetic Societies and expert in laser-assisted liposuction. He pioneers innovative techniques in body contouring and sculpting. I would request Dr. Anuya to take this discussion forward from here. Please consider 45 minutes for the discussion, and Dr. Medha has a few slides to share with us as well, which we would take in the last 5 minutes. Over to you.
Good afternoon, everyone. Well, we are all postprandial and slightly sleepy, so we'll keep it crisp and short. So, hello, doctors.
Hello.
Welcome. So, warm welcome to all of you. Well, we could start off with Dr. Umang and Dr. Purnima. And what do you think are the basic available modalities today when it comes to body sculpting? We could be looking at the deflation spectrum, and we could also be looking at the spectrum where you would want to reduce or cut certain parts of the fat. So, what is your take?
See, different modalities are mainly, I will divide them into surgical and non-surgical. Non-surgical, we would see there are a lot of equipments available, like cryolipo, U-lipo, tri-lipo. I have seen excellent results in tri-lipo and cryolipo both. And surgical, we have liposuction, we have tummy tuck. Liposuction can be of tummy, thighs, arms, also upper back, lower back. And tummy tuck is the other one. And we are talking about body modification, right? Not just for fat loss. So then there is breast augmentation, breast reconstruction, breast lift. I think Dr. Medha will also highlight all those areas. So I think these are the modalities available. If there is anything more, you can speak about it.
Yeah, so as you rightly said, it could be deflation or inflation.
Absolutely.
So for inflation, where you want to add up the volume, that could be fat transfer, that could be implant position, or that could be some other fillers, body fillers.
Yes.
And when we are talking about the deflation, or we want to take something out to create better contour, we have to divide as what tissue we are talking about, whether it's a skin laxity, whether it's a fat, or whether it's a muscle or a bone,
Right.
in that fashion. So the skin can be tightened with multiple non-invasive maneuvers along with radio frequency assisted, RF assisted
Yes.
body contouring or laser assisted body contouring. The small amount of fat can be dissolved by the deoxycholic acids. The larger amount can be dissolved with liposuction and non-invasive stuff like cryolipolysis, U-lipo.
Right.
So that's why I think we can divide multiple modalities.
Right. Who, according to you, is basically an appropriate candidate for these procedures? whether it's a surgery or it's a non-surgical procedure. How would you rate your client as an appropriate client?
So for me, in my practice, the appropriate client is a well-motivated client who understands the procedure and who has a realistic expectation. I always say to my patients that the role of a plastic surgeon is to make you comfortable in the skin given to you. If you're already comfortable, don't undergo any procedure because someone else is pointing out faults in your body. If you're happy, don't undergo anything else.
Correct.
So that's the prime focus in my practice.
According to me, appropriate client is the client who wants the procedure. Because this is my personal experience. I have had a girl of 19-year-old who came to me for breast augmentation. I tried to convince her and her mother also that this is too early and you can wait for some time. But they literally threatened me saying that, doctor, if you don't get a surgeon and you don't go ahead with the procedure at your clinic, we'll go somewhere else. So I think there is no appropriation as such. What is the will that patient wants? We have to deliver it. We cannot help it.
So, but at the same time,
yes.
there are certain patients who may be extremely overweight or not really fit to undergo a particular procedure. How would you, in those terms, how would you specify such clientele? Any examples that you would have where, it's like an absent, it's not contraindicated in the patient,
right,
but it is a patient whom you would refuse?
For liposuction specifically,
for
you are
asking? For liposuction or for non-surgical modalities. How do you choose a patient?
Yeah, so basically, how do you choose between non-surgical and surgical? If the patient is morbidly obese,
right,
usually we advise for liposuction. Because if they are 10 to 12 kgs of fat, approximately, suppose they are having only in their tummy, and they also have sagging of tummy area, then it doesn't make sense, if they are 90 kgs, 85 kgs, a female of 5 feet or is weighing that much, it doesn't make sense to do advise them surgical, take them through that 6 months, 1 year phase, and you lose the patient. That is for sure, because they are not going to listen to you. And plus, at least we do it very holistically, where we give them a food pattern, we give them exercise pattern, and then only we do it. So when it comes to choosing non-surgically, I choose as per the BMI. If the BMI is between 25 to 35, I advise them you should go for non-surgical. But if they insist, no, I want early results, then we do surgery as well. Dr. Mehta wants to say something.
Yeah, first of all, I would like to make a comment about breast augmentation, because FDA approves breast augmentation and use of devices only 21 years and later. So legality is very important. If anything goes wrong, you are going to be in trouble. So my first advice is to look at the legality of any request first. And secondly, Madam Purnima talked about BMI 25 to 35, but actually how many of them really respond to non-surgical modalities? So for me, any patient who's willing to follow appropriate diet, exercise regimen can show some fat loss on the given regimen. There are no medical contraindications. And if they are willing for surgery, surgery is really the best option, because non-surgical modalities work in very low BMI patients. Anything about 27, 28, it is very difficult, especially among women who are of childbearing age. They are the commonest patients who present with the request. So this is all hormonally accumulated fat.
Right.
And it is my point of talk everywhere that this hormonally accumulated fat cannot be lost by any other modality but by liposuction.
Correct.
I totally agree. Luckily that my patient, she is married and having children now. So this happened way back. Yeah, and I completely agree. For me also, my favorite modality of the treatment is liposuction. But sometimes it is difficult, even them tell them the safety part of the surgery and how it will help you to improve metabolism, how it will help you to improve your heart health. Also, sometimes they find, still in India, there is so much of unawareness for surgery and myths about surgery. I always tell them that now you are saying that you are thinking oh, surgery, liposuction. But when the time will come for you to undergo angioplasty or bypass, you will have no choice to say that whether I should undergo bypass or not undergo. Today you have a choice, that's why you are talking like this. So this is one way of convincing.
Do you feel the youth in this country is now opening up more practically to accept surgeries?
Yes, definitely. Recently we have done 28-year-old boy tummy liposuction. They are opening and they are understanding, but as there are still, majority of the clientele is menopausal women also are there. Who for them the metabolism has become slow, and whatever you may do, as doctor said, it is hormone driven obesity only, and in that age group it is literally impossible to lose weight. So for them surgery is the best option.
Because sometimes it's quite disheartening, to walk into a clinic and see a 135 kg guy going through cool sculpting or some sort of a non-surgical method where it's really not going to help in that.
Absolutely.
So coming down to what are the commonest indications that you are approached for in your practice?
So commonest indication for?
For treatment.
Yeah, that's body contouring or liposculpture. That's the commonest indication when I talk about the relevant topic right now.
Do a lot of people also come for sagging skin?
It goes hand in hand. So basically, they don't understand whether it's skin or it's fat. They just come with a particular area that doctor, can you treat this area?
Right.
And it's clinician's job to define where is the problem, whether it's a skin or it's a fat or it's both.
Right.
Or it's internal musculature which is losing the domain because of the visceral fat or the weakening of the muscle.
Right.
So they will just come with an area. But yes, mostly they go hand in hand and they have the skin as well as the problem of the fat as well. And then you see the stretch marks, whether the skin has lost its elasticity, whether the skin is good. You ask some basic history questions, protein intake and many other factors. And then you start making plan accordingly.
So basically you believe in a more holistic approach.
I think
as to taking care of their basic nutrition till taking care of the skin laxity and making sure you give them a complete makeover.
So I divide my patients into 3 groups. One group will come to me where they will say, Doc, I have lost 15 kg or 10 kg, and now there is a stubborn fat which I want to get rid of.
Right.
And when you talk about the youth, mainly the youth come with this kind of patient profile, where they are more health oriented. They follow some practices, either a keto diet or intermittent fasting, and then they come with a redundant fatty tissue. Another group will come that I want to start the journey. I know the lifestyle is important. Somehow I'm not able to start the journey because of my urban lifestyle. You give me some result and that positive feedback will push me for more workouts and more maintaining. And the third category will come as, Doc, I'm a foodie. I like to eat more. You remove this amount of fatty tissue so that I can eat more. And that's a complete no-no. Or they will come that I'm okay, I'm really happy with my life. This fellow is bringing me in all the clinics because he wants me to become slimmer. Even that is complete no-no. So motivated patient, along with those who understand the importance of lifestyle and diet, these are the main patient. And I always say them that the healthier lifestyle is a complementary to all this procedure. It is not an alternative. You can't say, okay, this is an easier path, let's get this thing done so that you can have your unhealthy lifestyle of smoking or drinking and having a late nights. It's not going to go hand in hand.
Who is an absolute contraindicated patient? Who is a patient where you would absolutely say no? Absolute contraindication.
Absolute contraindications are obviously the patients with morbid obesity because they are not within our domain of work. In fact, I believe in a multidisciplinary approach where there is a physician, bariatric surgeon, a dermatologist, an endocrinologist if required. Many times because such teams are not available, these patients are shunted between different specialities. But I do believe that such a team should be available and there should be a common approach. Absolute no-no is those patients who have psychiatric problems. There is
Body
something called
dysmorphia.
as body dysmorphic
BDD.
disorder. So if they keep on looking at the body all the time, looking in the mirror, they they think of their body all the time. And also the patients who are not emotionally stable, they are contraindications to me.
Anything to do with cardiac problems or
Uh,
pacemakers?
Actually, as I said, it has to be multidisciplinary approach, and I never operate unless I take a opinion from physician. And another very important thing is you must have a very good setup where you operate. Uh, I have operated upon patients who have had cardiac problems and diabetes and hypertension, but not without a physician's supervision and in a completely well-equipped setup. So if you are well prepared, then it is possible to give predictable results even in high-risk patients, and they benefit.
So essentially our procedures are quite safe.
Absolutely safe and beneficial also. We had one patient, me and Dr. Amodra, we had operated. She had a cranioperitoneal shunt and she had come from South Africa. But we did all her tests, which were not required also. We did all the screening, all the CT scans of abdomen, to CT scan of her chest, CT scan brain, MRI brain, everything we did. And because, see, this, our field is like elective medicine. And something goes wrong, just it becomes a big news. So we did all the tests, everything was okay, and we had the team of neurosurgeon, neurologist, cardiologist with us, gastroenterologist with us, and with all that we operated on her. Her liposuction and tummy tuck was done, and very well, successfully we did it.
In general, what are the do's and don'ts that you would give your patients pre-procedures and post-procedures?
I will take the first question, just a quick reply on my side. That the SOPs have changed in last 10 or 12 years, just you can say that. That liposuction, the body contouring procedures, now we have all the checklist. If you tick mark all the checklist, then you have very minimum complication. Now people come to us with multiple medical problems, but as Dr. Mehta rightly said, the physician fitness, the cardiology fitness, and if you limit yourself for 4 hours, 3 hours, do only one area at a time, and use energy-based device where there's a better recovery, faster recovery, you can actually take these patients. So yes, the things are riskier sometimes, but if you checklist on all the SOPs, it's very safe, very safe. I didn't get your next question.
My next question was, what are the do's and don'ts that you generally advise a patient pre-procedure and post-procedure?
Pre-procedures, there are where liposuction and breast augmentation or blepharoplasty, rhinoplasty is concerned. There are not many pre-procedures. Yes, definitely it is very, very important to do their counseling, because they all, somewhere or the other, we all suffer from BDD. Everybody wants to look good, everybody wants to be in good shape. So the expectations are something which we may not match to. So that's psychological counseling. And this is a lifestyle disease. So lifestyle modification is extremely important. So first do's and don'ts is the counseling. How much they eat, how they eat, what time they eat, what kind of activity they have since the time they wake up till they go to sleep. That is the very important. And plus what hormone imbalances they have. So according to that, it is pre-op. Post-op, where liposuction is considered is absolutely safe. The patient has to walk the same day. So there is nothing much that you cannot do. It is a very safe procedure. I am sure Dr. Medha will agree with me. So according to me, the don'ts are that post-op, you should take care. If there is tummy tuck, you should take care of the sutures. If there is breast implants, do not exercise heavily or immediately. Come for a regular follow-up. Take the approval from the doctor, and then only you start your activity. Then there are many, even if there is even breast augmentation or tummy tuck, sexual activity when it should be started. So these are the do's and don'ts, if you would like to add.
No, I think Purnima has covered mostly. One of my very important don'ts is don't eat sugar, chocolate and sweets. Only if the patient agrees to that, I continue my consultation. Otherwise, I walk out.
That's lovely.
The smoking, the nicotine,
Yes, when it comes to
nicotine
smoking
intake
and
is
drinking.
very much important. You have to counsel them to avoid it at least for 21 days before any of this procedure, invasive procedure. If they have the strong habit and they don't want to withdraw it, tell them you are in high risk zone. You may end up into more seromas, more complication. I mean, it's always better to communicate with them. Sometimes vitamin E, green tea intakes, and these are the things which is going to increase some bleeding in the superficial, like a blepharoplasty or small surgeries. So these are the things which I would like to know in my consultation.
Even antioxidants,
Yeah,
glutathione.
yes. And of course, the drug allergy, when you talk about the clinical history, the previous surgeries, the drug history and everything, yeah, any allergic history.
There are certain case studies that Dr. Umang Kothari and Dr. Medha Bhave would like to present. So we would like to start with them. How do you put the photographs there?
Slides uploaded. I'll start. By that time,
Fair enough. No, I don't hesitate.
Not at all. In fact, nowadays for both smoking as well as alcohol, both. No, we have to ask.
So you have to ask them.
Smoking, alcohol, and nowadays vaping. Among youth, vaping is very common, and among women also vaping.
change कर.
Absolutely.
इधर से करना है हाँ. Okay. So I have just selected a few cases which can help burst some myths about. So that is my clinic and operation theatre. So this is a patient who has got 2 children. She had a cesarean section, and like any other plastic surgeon, I had offered her tummy tuck, but she refused to have tummy tuck. She was an athlete, and this is the result of radio frequency liposuction. So tummy tuck is not essential anymore with newer contouring modalities, and this is a 5-year post-op result of the same patient. So patient should be willing to work hard, and they can really achieve good results provided we use some good skin contraction devices and do a good job of contouring the abdomen. Another myth is patients with high BMI should not undergo liposuction, or they should only have tummy tuck. But I strongly believe that we should not impose our expectations on the patients. That is what happens about many. This patient had 2 small children, so she wanted to have only liposuction, and look at the result. So even if a little bit of hanging skin is there,
How
she
many
is very.
kgs did you extract?
That is also another point I always make. It is not about kgs. It is about inch loss, because if I remove about say 5 liters, she is going to lose 3 kg only. But she is going to lose from her abdomen the volume which is going to make her comfortable to get into a healthy lifestyle. She can take care of her personal health, hygiene. She can be very active. She can play with her children, serve them better. So another patient, same. Now here what I do is I do their abdominal sonography, and I rule out that they have got any intra-abdominal fat. So while choosing, as you asked us about which patients are appropriate. So if this patient on sonography has got too much of visceral fat, then she is a bad candidate. then she has to go for metabolic. Otherwise, see how fit they become. Another use of this radiofrequency liposuction. Now, these are the 6 packs created by a plastic surgeon, and patient wanted to get rid of them, and this is the result of radiofrequency liposuction. Not easy with a regular liposuction. Another creation of 6 packs in a man. This is a bodybuilder. Now again about the myth of BMI. How much is the BMI of this patient? You tell me. See, this patient is a bodybuilder and her BMI is 38. So what matters is what has created the patient's weight. If the muscles are contributing to the patient's weight, even if BMI is high, it doesn't matter. All she has is upper abdominal fat and rectus sheath divarication, and this is the result. She won a bodybuilding competition later. This is a tummy tuck done with radiofrequency devices. So as I said, hormonal fat, unable to get rid of hormonal fat despite a rigorous diet exercise regimen. I am purposefully showing a very long-term follow-up. So there are many myths that surround liposuction and body contouring, and they need to be broken because they help women.
As you would ask me that weight reduction, so I always say that it's an inch reduction, as ma'am said. And sometimes we have seen that even if we remove 3 or 4 liters of fat, and if they are highly active in the lifestyle, they lose 10, 15 kgs down the line, because this stubborn fat, even this secret enzyme, liposuction, it has a lot to do with the physiology of the body, as well as with the anatomy of the body. The moment you remove the stubborn fat, there's a lot of metabolic changes that happens in the body. So it's a byproduct. What I normally say, the fat is a byproduct. We are sculptor. We make sculpture after the stone. The stone chips are the byproducts. The weight reduction is a byproduct. We never market it as a weight reduction procedure. It's always a body contouring procedure. It's an inch loss procedure.
I think along with metabolic changes, what is also equally important is that they go through a very good psychological change, because they start looking better, they start feeling lighter, and earlier it was difficult for them to exercise with that extra weight, which they can start exercising, and they get, as earlier speaker was mentioning, for validation. Even if we may say that we don't look for it, but somewhere back of mind, every patient. So once they start getting compliments, they start feeling better, start leading a better lifestyle.
We have also seen the PCOS women, they have stopped medications after these procedures. They were off metformin. We have seen documented results of HbA1c getting controlled. We have seen results of uncontrolled hypertension getting solved out because of this procedure. So these are the kind of effects of the procedure. So it has a lot to do with the metabolism as well as the psychological impact at the same time.
So thank you so much for your insights, and it was wonderful talking to all of you.
Thank you, Dr.
If there are any
Anvaya.
questions from the audience?
I thought okay, thank you.
Thank you so much.
We'll call Shriyal. Shriyal.
Yes, thank you so much for the discussion, and I would like to thank you all with a token of gratitude. You all can step ahead of the tables for the group picture. Yeah, step ahead of the table.